Chrysanthemums, sometimes called mums or chrysanths, are flowering plants of the genus Chrysanthemum in the family Asteraceae. They are native to East Asia and northeastern Europe. Most species originate from East Asia, and the center of diversity is in China. Benefits: Chrysanthemum may help to regulate blood pressure among individuals with hypertension. The adequate levels of potassium in chrysanthemum makes this possible. Chrysanthemum is rich in some essential oils that have antimicrobial activity and may help to treat infections. Chrysanthemum is a natural source of flavonoids, anthocyanins, linarin, and other health beneficial antioxidant compounds. Furthermore, it has anti-inflammatory, sedative, and anti-hypertensive properties. Therefore, it is not surprising that it is considered an adjunct to promoting well-being and reducing the risk of disease. While not a substitute for medical treatments, it can be an ally in some of them. Chrysanthemum tea helps in bone care, reducing the risk of osteoporosis, as its plant extracts contribute to the regulation of bone remodeling by inhibiting osteoclast differentiation and function. Furthermore, they stimulate the function of osteoblasts. Chrysanthemum tea contains high amounts of phenolic compounds, such as anthocyanins, and it showcased strong anti-inflammatory activity in an in vitro experiment. Possible side effects: Chrysanthemum flowers contain pesticides which are transferred to the water during tea infusion. Although the risk assessment in a study showed that the health risk from the most commonly transferable pesticides is low, these pesticides may cause allergic reactions to some people. Chrysanthemum tea is safe for most healthy adults when taken in moderation. However, it is contraindicated for people with allergies to daisies or ragweed. It is essential to suspend consumption when symptoms such as rash or respiratory irritation appear. Chrysanthemum may interact with prescription drugs. Therefore, if you are being treated with medications such as anti-inflammatory, antibacterial, etc., it is better to consult a doctor before consuming it. Its consumption is also not recommended in the following contexts: pregnancy and breastfeeding, diabetes, skin sensitivity, and diagnosed hypertension. Chrysanthemum may trigger an allergic reaction such as respiratory or skin irritation. Its use must be discontinued among individuals who are susceptible. Quantity recommendations: Chrysanthemum is reported to have a cooling effect and should not be consumed in large quantities for a long period. It is advisable to restrict its intake to about 2 to 3 times a week. A drink of chrysanthemum per time is okay. The appropriate dose for chrysanthemum tea may vary individually, but it would be advisable to not be ingested on a daily basis. 1 cup 1 to 3 times per week can be consumed after meals or close to bedtime to aid digestion and relaxation.